In this lecture, you'll look at the pancreas as well as diseases and disorders like stress and diabetes. During the last lecture, you learned that the pancreas is both endocrine and exocrine in nature. The endocrine portion is the islets of Langerhans, and it is composed of alpha cells which secrete glucagon, which increases blood glucose levels, and because it does, it's known as the hyperglycemic hormone. It also contains beta cells that secrete insulin, which decrease blood glucose levels and is known as the hypoglycemic hormone. Like calcitonin and PTH, insulin and glucagon are antagonistic hormones. The trigger for the release of insulin is high blood glucose levels, and the trigger for the release of glucagon is low blood glucose levels. So therefore, the overall effect of insulin and glucagon is to regulate blood glucose levels and to try and maintain homeostasis. The diagram on the right will show you this. Please take a careful look at it. The term diabetes mellitus means sweet urine, and it's called that because there is excess sugar in the urine. Centuries ago, physicians would taste a patient's urine as part of the diagnosis to determine if they had diabetes mellitus. Diabetes is usually due to one of two things, either hyposecretion of insulin or hypoactivity of insulin. There are three kinds of diabetes. First is called type 1 or IDDM or juvenile onset diabetes. IDDM means insulin-dependent diabetes mellitus. It's autoimmune in nature, and the problem is there has been destruction of the beta cells by the body. Because they've been destroyed, not enough insulin is produced. The second type, or type 2, is known as NIDDM, or adult onset. NIDDM stands for non-insulin dependent diabetes mellitus. A person's receptors don't function well, but usually they do have enough insulin. And the third kind of diabetes mellitus is gestational. This occurs during pregnancy, and usually with delivery of the baby, it will disappear. There are many signs of diabetes, but the most important are known as the cardinal signs or red flags of diabetes, and there are three of those. The first is polyuria, meaning many urinations or frequency of urination, polydipsia, meaning many thirsts or extreme thirst, and polyphagia, which is many hungers or extreme hunger. Why these signs? Think about it and see if you can come up with an answer. The answer to the question in the last slide is there's polyuria because there's a lot of sugar in the urine and water tends to follow solid particles. The reason for polydipsia is because there's a lot of urination and a lot of water loss, and it triggers the thirst center. And the reason for polyphagia is because the sugar is not getting into the cells, but it's staying out in the blood and being carried out of the body. There are other early signs of diabetes mellitus, and they include nervousness or jitteriness, irritability, and unexpected weight loss, and we're talking 10 to 15 pounds over maybe a month to 6 weeks, and blurred vision. The following slides deal with long-term effects of diabetes, and some of them may be graphic. You may choose not to view them, but if you view them, please view with caution. If you have diabetes, you should expect the doctor to ask you to remove your shoes and socks on your visits. The reason for this is they want to see if there's been any change in your skin color. Is there any swelling? Are there sores that have begun to develop? Do you have ingrown toenails or cracks and cuts? All of these can make severe sores a possibility, and they want to prevent this. About 15% of patients with diabetes will develop an open sore known as an ulcer. It's commonly located on the bottom of the foot. Of those who develop a foot ulcer, about 6% will need to be hospitalized due to an infection or other complication. Gangrene is a type of necrosis caused by a critically insufficient blood supply. The primary cause of gangrene is reduced blood supply to the affected tissues, which results in cell death. Both diabetes and long-term smoking increase the risk of suffering from gangrene. Most often in someone with diabetes, gangrene occurs in the fingertips and the toes because these are the areas of the body where it is most difficult to get oxygen. The most common treatments for gangrene are surgery and antibiotics. There are different kinds of gangrene. This is called dry gangrene, and it's the most common in people with diabetes. A red line appears on the skin that surrounds the affected tissue. This is the first thing you'll see. When necrosis occurs, there may be some pain. The area will gradually become numb and cold and will change from this red color to brown and black. The tissue begins to shrivel and eventually will fall. When gangrene is diagnosed, immediate treatment is important, and it may involve one of the following emergency measures. Antibiotics may be administered directly into the bloodstream, and this is known as intravenously. Removal of the dead tissue surgically, including sometimes amputation of an extremity or even a whole limb to stop the wider spread of gangrene, and in some cases, reconstructive surgery involving skin grafting and other techniques may be necessary. You can see this reconstructive surgery on the end of the thumb in this picture. In this picture, you can see the recently amputated great toe and the area of spreading necrosis. Amputations are necessary when efforts to save the foot or the leg are unsuccessful, or if the infection is causing extensive tissue damage. In every case, doctors try to save as much of the person's foot or leg as possible, and they try to make sure that the remaining part of the limb will heal so that further surgery is not necessary. You can see in the picture here, because of this person's very poor circulation, that an infection has set in after the amputation. Other long-term effects of diabetes are blindness, kidney failure, and heart attack, and all of these are due to their compromised circulation. Here is a list of some of the treatments for diabetes. It's important that the diabetic exercise and lose weight if necessary, to eat a well-balanced diet. Some will require insulin injections, some will require medications. Beta cell transplants are an option, and the insulin pump is another treatment. Let's look next at the adrenal gland. The term adrenal means on top of the kidney. Ad means on or close by, and renal refers to the kidneys. It's actually two glands in one. There's an adrenal medulla, the middle portion, and an adrenal cortex, the outer portion. This and the next slide are microscopic views of the adrenal gland. You'll notice the two glands in one, and that's the cortex, the outer portion, and the medulla, the inner portion, and you can see how they look different from one another. Surrounding the adrenal gland is a capsule made of fibrous connective tissue. Here's another microscope slide showing the adrenal cortex, the outer portion, the adrenal medulla, the inner portion, and the fibrous connective tissue capsule surrounding the outside. The inner gland, the adrenal medulla, secretes the catecholamines, epinephrine and norepinephrine, sometimes called adrenaline and noradrenaline. These hormones help us to deal with short-term stress. Epinephrine and norepinephrine both trigger the fight or flight response. The outer gland of the adrenal gland is called the adrenal cortex, and it has three zones. The first is zona glomerulosa, which secretes mineralocorticoids. The function of these mineralocorticoids is to regulate blood mineral balance. The middle zone is zona fasciculata, and this secretes glucocorticoids like cortisol. These help us to deal with long-term stress. And the third zone is zona reticularis, which secretes glucocorticoids and some sex hormones. We're going to talk about stress. Please put this in slide mode and click through this and the next 4 slides. One way to determine if you're stressed is to take a stress test. This is one of the more commonly used stress tests developed by Rosalind Forbes. Here's the answer key. Choose the answer that applies most often to you. There are 20 questions on the next 3 slides. Please answer them to the best of your ability and then tally your score and see what your results indicated. I hope your score was better than mine. We all have a little bit too much stress in our lives and need to decide what we can do to cut down on that stress. On the following 2 slides, you'll find a second stress test. It was designed by a doctor at Duke University in Durham, North Carolina. He's the author of the book Anger Kills. There are a total of 9 questions. Take this and see how it compares to the first stress test.